everybody. My name is Julia Lee. I've been an RN for 27 years. I would like to tell you some information regarding MRSA, which is very prevalent in the hospital. Have you ever asked yourself, what is MRSA? Well, I would like to tell you what MRSA is. MRSA stands for methicillin-resistant Staphylococcus aureus, which is a tiny bacteria that is very hard to treat. I would also like to give you a little history behind MRSA. MRSA came about, according to Nancy Day. Researchers developed MRSA when they was trying to treat just a Staphylococcus bacteria. They was trying to treat it with methicillin antibiotic, but then around 1980 they found that the methicillin antibiotic was very hard to treat for the Staphylococcus, which made the name MRSA come about. Also, the first strand of MRSA came about in 1960. A tiny strand of MRSA was brought from Cairo, Egypt. And according with the Center of Disease Control, the first person died from MRSA in 1999. I would like to tell you some signs and symptoms of MRSA. MRSA, there are some redness, some pimples, also pulse and boils, and very warm to touch at times. It's sometimes mistaken for a spider bite. If you notice on the screen, spider bites and MRSA are very similar but very different. MRSA is treated with several antibiotics regarding for the MRSA bacteria. MRSA also can produce skin infection, abscesses. As you see, according to WebMD, very wonderful slides regarding what MRSA exactly look like. It can be very painful, hard to treat. MRSA. How do people catch MRSA? People catch MRSA by direct contact. It can also be caught by sharing needles, sharing towels, and athletic and gym wear. Also, 2 in 100 people carry the bacteria on their body but usually never get sick. Who get MRSA? MRSA is seen when you have recent surgery in the hospitals. It's also seen with people in the nursing homes. Also seen with people that's HIV and immune compromised. A very stubborn bacteria, very hard to treat. I'll say for the hospitals are full of MRSA due to the high traffic of illness and wounds that exist in the hospital, but can be decreased by using good hand washing. It's okay to ask your nurse to wash your hands in the hospital prior to touching. Can healthy people get MRSA? Of course. There's an outbreak called community-acquired MRSA. In case you don't know what a community-acquired MRSA, that means that MRSA is now in our communities. You see it in the schools, the gyms, the daycares, and places where people share close quarters. How is MRSA diagnosed? It's diagnosed under the slide. It usually takes anywhere from 12 to 72 hours for the confirmed diagnosis to reach. MRSA, based on the diagnosis of MRSA, if you were in the hospital, they'll put you in close contact isolation. How is MRSA treated? MRSA is treated with several oral antibiotics depending on the location of the infection. There's a list of some of the common antibiotics that's treatment for MRSA. Methicillin, amoxicillin, penicillin, oxacillin, also Zavox. But one of the main antibiotics that is treated in the hospital is vancomycin. Vancomycin is a very strong antibiotic which you have to watch your kidney function. There are very new drugs hitting the market with MRSA. There even has research where Dr. Kim with Tustin University said that even plants are going to be a treatment for MRSA. MRSA complications. They can involve your internal organs, your body, also infect your bloodstream, And recent CDC reports found over 80,000 severe MRSA infections and 11,000 deaths per year regarding MRSA. How to avoid MRSA? Good hand washing. Use alcohol-based sanitizer to avoid MRSA. Wipe off surfaces that you come in contact in the gym. If you're not sure about MRSA,